My case is, as the title says, an emergency treatment of stress-induced back pain and anxiety. I got a phone call one afternoon from a woman who said, could I see her husband very soon? He was in severe pain and he was not himself anymore. So I agreed to see him the next morning at 8 o'clock. The person was a young man, 34 years old. Yeah. He presented with severe back pain and hip pain, and he had sciatica down his left leg. He also had pain between his shoulders, going up into his neck. He didn't have headaches, but shoulder and neck pain. And he was severely sleep deprived. He was working night shifts, had been working night shifts for some considerable time, and only got about 2 hours sleep during daytime. He had started to get anxiety attacks, and he told me that he was very snappy towards his work colleagues, but also what worried him very much towards his children and his wife. Patient B, he is from Northern Ireland, and he was hired for a management job for a restoration project of a government building. His contract was running for 12 weeks, non-stop, 7 days a week, and he worked from 8 o'clock in the evening until 8 o'clock in the morning. So he had come straight from his night shift to see me, and the only sort of light at the end of the tunnel was that his project was going to finish 3 weeks time later. Although he was in such a state that he wasn't even sure whether he would get there. He was visibly in pain. He had very stiff shoulders. He was he was in despair, and his shin was just very down. The pulses were very strong, which I just put down to he was probably totally adrenalized from his night shift, except for the kidney positions, they were weak. And his tongue was very red and had teeth marks. He had been seen by I think it was an occupational doctor, because he was from Northern Ireland. He didn't really have a GP here. So he was given citalopram, a common antidepressant. However, when he started taking it, his appetite disappeared, and he could sleep even less than his 2 hours. So he stopped taking it. He was also given diazepam and naproxen and codeine, but he was clearly still in severe pain, so the drugs helped a little bit, but not greatly. I diagnosed massive G stagnation. I'm not sure whether that exists in TCM, but I just put it down anyway. So severe G stagnation. And his anger outbursts, liver G stagnation, his exhaustion, spleen G deficiency, and his Shen heart G deficiency. What I did first was I sat him down and gave, for 5 minutes, did some tuina on him. Basically to loosen up his shoulders and neck to some extent, and also to help me finding points and channels which were affected in his neck and shoulders. Then I used quite a lot of points, probably more than anyone else in this room, I have to say that's how I was taught. So that's what I do, not always, but in this case and in cases where there is a lot of pain, I tend to use quite a lot of points. So what I did, I used do 20, and I used bladder 10 and Huatotachi points on the level of T9. And I used electroacupuncture between bladder 10 and the Huatotachi points. I then also used gallbladder 21 and large intestine 4. This was actually something I picked up from a talk, from a conversation I'd had with Hamid Montakab. When I asked him, I think I asked him for advice on somebody who had severe headaches. And he said, it's quite a good idea to use bladder 10, do 20, bladder 10, and then some points gallbladder 21 or large intestine 11 or large intestine 4 or a combination to free the flow of qi down from the head through the neck and into the limbs, into the arms, to let that go. And I've used it many times and I found it really useful. I also used the small intestine points on the shoulders, small intestine 13, 14 and 15, and I then added a distal point, bladder 65, for neck problems. This was really to address the neck and shoulder area. I then used another set of points to move qi and blood in the lower back, which is bladder 18, bladder 23, bladder 28. Sorry about my pronunciation. Gallbladder 34, bladder 60, and I used on his affected leg the gallbladder 30 to release the sciatica. To calm the Shen, I used bladder 43 and heart 7. And I also used moxa on shoulders and back. And just one note for that, I use very generally the non-smoke moxa stick. On contrary to what was said earlier on, I do find that it's helpful. I know there's big debate about smokeless moxa, but I can't use anything else, and I find I really want to use this warming way of warming points, and in my hands it seems to be helpful. I also recommended that he drinks more water, that he takes some exercise because he was actually sedentary in his work, and that he could use heat plasters on his lower back. I could only see him a week later, but I was very delighted because even when he came through the door, he had a spring in his step, he looked up, he was just so much more happy. He told me that his pain had down in his hip and down his leg had gone 2 days after acupuncture, so not immediately. And I'd said to him that it may take 24 hours or so to abate, to do something. He still experienced some pain between his shoulder blades, but he told me that it started to go swimming. So he listened to my recommendation to take up some exercise. And the swimming after his night shift helped him to switch off better and have a better night's sleep, or better day's sleep. And he thought the heat plaster was helpful too. So overall, I was surprised because I wasn't sure whether one treatment could do so much, but it was wonderful to hear. I more or less repeated what I did in the first treatment, but I used fewer points. There was actually less to treat. So I still did do 20 at bladder 10. I then chose to do electroacupuncture between the small intestine points, small intestine 13 and 15, and I still kept the bladder 65 distal point. I used fewer lower back points, and one point I did add was kidney 4, because he still experienced some panic attacks, some anxiety during his working nights. When he came back, that was then 9 days later. He had experienced a few occasional twinges in his lower back. His neck and shoulders were still tense, but they were now not painful anymore, and he had only had one bad day with anxiety. He was very much looking forward at that point to finish his 12-week job and go back to Northern Ireland and spend some more time with his family again. So that was, did I go backwards? Sorry. Yes. Again, the treatment was very, very similar. Some changes, I did a bit more in his lower back, but otherwise very similar to the previous one. And that was it. I didn't actually see him anymore because he went back to Northern Ireland. And I did give him the BACC website and told him, please seek out an acupuncturist in your area where you live and go back to have some follow-up treatment. So what I was very pleased in this case is to see that it's possible to make a very quick and pronounced difference. And I think it's probably down to that it hadn't been there for too long. And I can certainly suggest that self-help interventions do really support what we do in our work. And I was very pleased that our holistic treatments help not just with the physical symptoms, but with the emotional aspects. Thank you very much.
Thank you very much, Pia. I've got a possible question about numbers of points and whether that should be different between acute situations and more chronic situations. And I imagine that Shuzhe, who spoke right at the beginning, might say that he would have done it with just 2 needles. But I'm not going to challenge you on that.
I was actually.
Yeah.
I was thinking about that when he was giving his presentation.
Yes.
I thought, oh my God, and I'm coming with about 15 points.
Yeah.
But I guess we have different ways of treating, and that's just what I do. And acupuncture is amazing. It just works. We have different styles and we do different things. But I mean, there are certain things we shouldn't do. But when I first started acupuncture, my acupuncturist put in 30 needles. Now, I don't think many people in this room do that, but it helped me. All I can say, it helped me, and it actually convinced me that acupuncture works.
When I had a treatment in China for acute shoulder spasming muscle, I had about 20 odd needles in and a load of moxa and stuff. I fainted actually. Any questions? Any more questions of Pia?
Just to tell you that I use a lot of needles as well.
Thank you.
And I found them, especially for muscular things, they are amazing. And if you use palpation, where the stagnation is wonderful. But yes, I have used more than you. I would say in some treatments 50. So yeah.
Thanks for that. What was your rationale to use electroacupuncture in those points?
I just, the first thing I have to say is that I recently read Stephen Lee's electroacupuncture book, or I got it, and I was always leaning towards using electroacupuncture, but his book has revolutionized what I do now. It gives very clear, simple instructions. And he's a 5-element practitioner. So I didn't expect this sort of treatment advice from somebody with that background. So that encouraged me to use it more. And I found that in many places where there is stagnation, electroacupuncture really is moving things, and moving things a bit faster than if you just do 5. You can do 5 treatments, but with electroacupuncture, I think you can get away with just 2 treatments and things move quicker. It's simply that you could do this stimulation by hand, but it's more comfortable with electroacupuncture, and it is a bit more stimulation, but it's also quite comfortable because I always do it in a way where the patient feels comfortable with. It should not be painful. It should be just a light pulsating or sort of a little sensation, and people find it quite nice to experience that, in fact. And I use alternate frequencies, which I also got from the advice from Stephen Lee's book.
Hi Pia, thanks for sharing a fantastic result. Great job, and as well as his back and hip stress levels, you may well have had a hand in saving his marriage there by the sound of it as well.
Possibly, yes.
I'm not personally averse
Acupuncture did that, not me.
I'm not personally averse to using a lot of needles in certain situations. I think the jury's sort of out, I suppose, to some extent, of what's more effective than the other. I guess the limitation would be it's hard sometimes to know what did what for what when you're using a lot. So I'm sure he's happy, he doesn't care how many you put in if he walks out the door happy, but for you, learning, it might be hard to get feedback. Were there certain points that might be more important? What's your perspective? Did you feel that certain things there, certain protocols like the electro with the Do20 or some of the more local points around the back might have more of an impact, or was it quite hard to gauge in that situation?
I didn't do electro on Do20.
Oh, sorry, it was that.
By attempt to, yeah.
But yeah, sort of open question. Did you get a sense of some points might have been more important than others in that situation?
I feel he made a big move already on the first treatment. So I presume that the electroacupuncture I did there, really along the dew channel, bladder dew channel sort of probably did do a good job. But then, it may have just been that he received acupuncture and, he hadn't had any previous experience. And he was able to lie there for 20 minutes and being cared for. And who knows? Yeah, it's true. I don't know. I find this sometimes, I didn't have a lot of time with this person because he was going to go back in 3 weeks' time. So I tried to help as I can. Maybe, yes, you're right, I may have gone away with less, but I don't know. Yeah, I can't say. Yeah, but what's the point?
Great job anyway.
So you did all that in 20 minutes?
No.
It's just you said he lay there for 20 minutes.
That's 20-25 minutes is how long the needles are in. No. That took me an hour and a quarter, the whole. Yes.
Thank you very much, Pia.